In today's class, we are going to see the most important topic in Unit 5, that is laparoscope. So, the learning objective of today's class is that first we will have a short introduction of what is difference between endoscope and laparoscope, and then we will be discussing the empathy perspective of why this laparoscope is needed. What type of challenges is being overcome by using this laparoscope, and then slowly we are moving into what is mean by laparoscope and how does it works, and what are the essential equipments which is being involved during laparoscopic surgery, and then also we will be discussing laparoscopic procedure each step by step, and finally we are winding up with the different kind of applications of laparoscope. So the difference between laparoscope and endoscope is that the laparoscope is nothing but is a one kind of endoscope. Here we are making the small incision in order to navigate the equipment, that is a tool inside the body in order to visualize the internal organs of the body. Whereas in case of endoscope, we are sending the tool through natural opening, that it can be like your mouth, through your mouth or through your nose or through your anus. But in case but the same concept, the endoscope also is being used to visualize the internal organs, and laparoscope also the same, which is being used to internal organs, that the point of access is different between endoscope and laparoscope. So now we will be discussing with the empathy perspective of this laparoscope. If you take endoscope or the laparoscope, the main empathy perspective is that compared to the traditional surgery or a traditional open surgery, so where it involves more pain, where it required a very large cut, and where we have very blood loss to carry out the surgery, and also the people will feel very anxiety, and also they are like a very uncertainty about what is the outcome of this surgery, and it will involve so many complications and risks, and recovery period of post surgery is also it's depends upon type of surgery we are doing. And then if you see after surgery, the scar, that is the mark which left out will create it's very great impact on their self esteem. So and also since it's a open traditional surgery involves a very long procedure, it makes the person to stay over more than more 1 or 2 weeks, based on the recovery period, based on the recovery ability of the particular patients. So it also end up with the lengthy recovery periods. So the different sort of what surgery fee, I mean traditional surgery fears that is being collected during the empathy perspective. So the final, as a result, the problem is that we can see in traditional surgery, that is open surgery, it involves large cut, cause more pain, and you can have a very much tissue damage, and also end up with very long recovery. So this is the problem. So the solution what we need is that we need very safer, and if possible, non-invasive is the recommended, or it can go with minimally invasive options to maintain the comfort of patient and also quality of life, improve the quality of life. So as a result, as a solution, this is where the laparoscopy comes, that is one type of endoscope. Here we are using very small, that is comes under category of minimally invasive options for precise diagnosing the problem, and also we can treat the problem, thereby we are improvising the quality of people. So this how the empathy is being collected, and we define the problem, finally we brought out the solution through ideology method. So then we will move on to slowly what is laparoscopy and how does it work. So as I said, the laparoscope is nothing but type of endoscope which is being used to insert into your body to visualize the internal organs of the body. So the insertion method we can make here with help of small insertion, especially near the navel in the stomach, and we will be sending CO2, is a type of gas which is meant for inhalations. That's why the abdomen cavity will get expand to some extent to have a clear visibility. And finally, we have visualization option, that the component called HD camera, which gives you a precise, clear real-time visualization of internal organs, which enable the surgeons to do surgery or to diagnose the problem. So the essential laparoscopic equipment is that, as I said, the laparoscope is very important. It's a rigid endoscope with a lens system, and then we have camera systems which is being kept outside to visualize what is there inside the organ. I mean, inside the body, that is the target of the organ. And then we have a light source, because the light source is very much important to illuminate the targeted area to visualize even more clarity. And then we have option of use extra tools, that is surgical instruments, that is like graspers, scissors and cautery device, which is been utilized based on the type of examine we are doing. For example, if you want to do biopsy, the scissors can be used to pick up small piece of samples to check whether the person have any type of cancer or so on. And this how the laparoscope equipments and the instruments will look. We have a rigid type of flexible tube that it's been insulated by some sort of polymer, and then tip you have a needle, I mean a needle, so it will be easy to navigate. And also we have so many options with additional tools. As I said, if you want to do any type of, I mean if you want to take any type of biopsy samples and so on, or you have to have a very good grip of that organ, we have a graspers and clip and so on. So like and the tip has the articulations of about 36 360-degree rotation. It has the property to rotate all 360-degree angles, so that we can have a proper navigation, proper guidance, easy to access the area of the targeted area. And then other side, I mean fourth picture I have given the different handle of this instrument, the based on comfort. Other surgeons can go with different types of this. So next we have move on to the step-by-step procedure of laparoscopy. The first we have to make preparation of the patient by giving anesthesia, and then make them feel very comfort and safe by saying what are the procedure will be carried out, and we are making them calm, and by giving anesthesia ready for their preparedness. And then the second one, we will make small incision, that is about 5 to 10 mm meter. We will do it with precise surgical techniques. And then once the incision is been made, then we will go with the gas insufflation by sending CO2 gas, which is help to expand the abdomen cavity, so that with the help of light source and the lens system, we can visualize the internal organ of the abdomen very clearly. And then we once everything is been done, then we slowly we will insert the scope, which is nothing but laparoscope, with the help of a protective trocar port. So this protective trocar port is it's a kind of laparoscopic tool, surgery tool, which is being sent to place the scope to the point of the area, that is the cannula, through which the cannula will be inserted to the point of contact, I mean point of targeted area. And then this trocar will be once it's been fixed to the pointed area, then it easily then slowly it will be removed. And also it ensures the sealing of incision port, so that the CO2 whatever we have sent inside in order to insufflation, it will not get leak, or it will not escape from the abdomen. So this how the trocar port will helps out. And then finally we have visualization system, because inside you have lens and light source. Through light source we will focus with the help of lens. The outside we have the monitor, the whatever the camera which is being whatever the camera which capture the internal organs, which is being sent to the outside, we have the monitors that the surgeons can see the type of problems, or type of the structure or morphology changes of that particular area. And then finally treatment we will go with either if you want to do any, I mean deliver any kind of medication to directly, or if you want to take any samples for diagnosing, or if you want to remove any improper or tumors or any kind of abnormal growth of tissue, that also we can do it. So that is how the treatment get varies depends upon the type of problem for what we are examining. So on the recovery and the completion also, the procedure completion is that once everything is done, the surgical sites are inspected for the completeness later, and then slowly we have to remove the gas, CO2 gas which is being injected during a incision. That has to be eliminated without discomfort of the patient, and finally the incision closer we have to do it, because the small incision is required to send the laparoscope, and then the same insertion which is being which have to be closed either by using surgical clues or any stitches. So how does it laparoscopy helps, and what is the outcome, what is the benefit of this laparoscope? In the sense, it is minimally invasive, which is unlike endoscope, it is not at all invasive. It is through without making any cut, we are sending the natural opening, that is through mouth or through nose. But in case of laparoscope, anyway we have to make very small incision with very less tissue damage, so it is not that much pain or that much complications compared to the open surgery. And also we have high precisions, we have a very small incision and a magnified visualization, so it is very much recommended. We can easily access to the targeted area and visualize the targeted in the in-depth of the in-depth part of the internal organ. And then fast recovery also, it is very much possible in case of laparoscopy, because it which is being involved with very small incision, and also even the patients can return home on the same day, or even to the maximum or 1 or 2 days. And then we have very less complications compared to the open surgery. The reason is that we are not making very large cuts, so there won't be any huge blood loss. So the complication associated with this type of minimal invasive type, the complication is very less compared to the open surgery. So the wide application is that we can use for any sort of gynecological issues and general surgery, gastroenterology, urology, that is the kidney stones and prostate condition. Finally, we have your oncology also. So finally, what we want to conclude with this particular topic is that the laparoscopic surgery is very much recommended to the case where the normal surgery doesn't have your option to assess the any particular internal organs, and also and also where the magnified visualization is needed. So this particular technology is a combination of both advanced technology and compassionate treatment, which helps the surgeons and as well as the patients to have a faster treatment or diagnosing method and also it will improvise the patient comforts and the quality of life, and also it makes the doctor's work to be easier. So this is the one kind of activity which I used to play in the classrooms. Where I will make into two teams, team A and team B. Team A will be act as their biomedical engineers, and team B will act as their surgeons. They both will be discussing about what is the latest invention. The biomedical engineers will discuss about what is the latest invention, innovations or there in laparoscopic camera systems, and surgeons will discuss about what is the benefits and practical challenges which is being faced during their surgeries. So at last we come to know the people how far they are understand this particular topic with in align with the recent trends and technologies. And followed by we have assessment related to this topic. This is the mind map. That is a summary of this today class about the laparoscopic. First, we will initiate with the basic comparison between endoscope and laparoscope. Then we will move on to laparoscopic surgery and how does it works and the essential equipments, and then step-by-step procedure of laparoscopic surgery and how does it recovery process and the complete and completion mechanism will take over, and the benefits of advantages and applications. And this is the reference where I referred and collected the information for this topic. Thank you.